Senator Puglia.
Can one of my colleagues that supports this bill explain to me how we are not putting kids more at risk by requiring all students to be vaccinated when the evidence presented by medical professionals shows that immunocompromised kids are more at risk from those who are just recently vaccinated, who have a shedding of that vaccine?
I invite somebody from the medical profession to come and address that question. Okay, we've got.
Go ahead, Laura.
I'll go first. Hello, committee. My name is Dr. Laura Blaisdell, MD, MPH, working with Intermed Pediatrics. I'm a practicing pediatrician, an infectious disease researcher, a vaccine hesitancy researcher, and I'd like to address your question of viral shedding. It has been suggested that vaccination causes viral shedding, and the outbreaks that we're currently seeing are the result of vaccine viral shedding. There are several very good bodies of literature that demonstrate that shedding that occurs after certain vaccinations can occur. The shedding of that vaccine, not the wild type disease, not wild type measles, not wild type chickenpox, but the attenuated virus that can be shed, is only exceedingly rarely transmitted between a vaccinated individual and a healthy immunologically healthy individual. By way of factors, we're talking 3 or 4 times it's been documented in 55 million doses. And when that individual did contract the disease, say chickenpox, the difference visually in chickenpox between 300 pox marks across a child's back is 4 or 5 pox marks across that child's back, and they do not have a severe virulent disease. It has never been documented in transmission in measles, mumps, rubella, which is the only other vaccine required by this law that could possibly, theoretically, demonstrate viral shedding. The other important aspect that I think has been blown out of proportion in this argument is that doctors do recommend that people who have living in community, in close contact with immunocompromised individuals, for instance, my patient's father who had a liver transplant, should not receive the vaccine. My patient should not receive the vaccine because an immunocompromised patient is at risk of contracting that disease, that virus, that vaccine attenuated virus from the vaccinated child. In an immunocompromised patient, the visual of 4 or 5 pox marks on a back looks exceedingly different. And it looks different specifically because they are immunocompromised. So the risk of those individuals is quite high, and they could possibly lose their transplant. And they need to be hospitalized after they've been exposed to that. So yes, there are times that we do recommend that people stay away from people who are near immunocompromised people are immunocompromised. But to be clear, the outbreaks that we're seeing currently are not a result of viral shedding from vaccinations.
What are they a result of?
Decreased community immunity.
Because the person who had a disease in Maine, according to the information from CDC, had already received the vaccine.
Which case are you speaking of?
It's buried in here somewhere, the data that they gave us.
I'm sorry, I'm not going to speak to that. I was going to speak to the viral shedding, but perhaps Dr.
Do people who are vaccinated contract the diseases ever?
For which vaccine?
Any of them that we're requiring people to get.
Not for polio, not for MMR typically, not for Hib, not for pneumococcal, not for Hep B, not for Hep A, and sometimes for influenza, not for tetanus, not for diphtheria, and sometimes for pertussis.
So yes, sometimes is your answer.
rarely in occasional diseases, yes.
Thanks.
Larry, would you like to say?
Yeah.
Is there, sorry.
Cool.
My name's Larry Losey. I'm a pediatrician practicing in Brunswick for 40 years, and I'm a member of the Maine Vaccine Board and all that stuff. Anyway, none of the vaccines are entirely perfect. About 30% of the people getting measles in one study that I saw have been immunized. However, 95% of the people have been immunized, so it's much lower risk. The outbreaks that we're seeing currently in Clark County, Washington, and Queens, New York, we can find out and tell you who brought that measles into the United States. There are several countries that have much lower rates. Measles has become recurrent, and we can identify people who bring it into a community. Susceptible people in contact with them can then get it, and vaccine hesitants tend to be congregating together, be together, and provide a lot more opportunity to spread the virus.
Senator Puglia?
Thank you. Thank you for the opportunity to ask a follow-up. We just heard from Ms. Blaisdell that nobody that gets the MMR vaccine has contracted the disease. Is MMR the one that covers mumps? I'm not a doctor.
Yeah, measles, mumps, and rubella.
According to this CDC report from 2017, Maine surveillance report from the Maine CDC, one diagnosis of measles, that individual was not vaccinated. 100% of the cases had an epidemiologic link to another measles case. Okay, so that person was not vaccinated. But the mumps case, one diagnosis, that person was vaccinated according to this information from CDC. So can people that have been vaccinated contract these diseases?
And I wish I could have some time to talk with Laura, because I think that she answered a question that was different than what you thought you asked. Because yes, you can get measles after getting the measles vaccine, but it's well over 90% reduction in risk. All of the vaccines, there will be an occasional, your immune system might not have responded to it because you had a cold. We're producing a chemical called interferon. There are a lot of different reasons, but we're looking at overwhelming protection, but not 100%.
It's just really bizarre to me.
So, Senator, I'm going to...
No, I just have a question about this, yeah. That the one case that we've had of mumps in the state of Maine, the person was vaccinated. So how can we go out to the public, I'm asking for your medical opinion, and say that what we're doing is for the greater good, when we have documented evidence that shows that this work that we're doing in the name of the greater good actually results in cases where individuals still contract a disease that we're trying to protect people from?
Yeah, and science is always evolving. We're seeing a number of college and, interestingly enough, NHL outbreaks of mumps in the last couple of years. And we're looking into what can be done to improve protection. Whether it's waning immunity, some other factor, we don't know, but it's being worked on. I just know that I've never seen a case of mumps except for my own when I was a kid.
Doctor, that one person that developed mumps, what percentage of the overall population that had received the vaccine do you think that person represents?
You know, how many people have received mumps vaccine are susceptible to it? It's going to be well under 5%. That's pulling a number out of the air. I don't have that number in front of me. But the overwhelming majority will be protected.
Representative Sampson?
Thank you, Madam Chair. Thank you, Doctor, for being here. So I have a couple related questions. So to the mumps outbreaks and how that can be transmitted, can you explain to me how a ship of Navy individuals who are fully vaccinated and then some,
The military does have a reputation for that.
How do they continue to cycle mumps through that ship that is totally quarantined for the last 3 months out at sea? Can you explain that, please?
The short answer is no. I can't explain it. I can speculate that I don't know what the military's status is for repeating mumps immunizations on admission. I know they get lots of shots, but I've never been a military physician, so I don't know which ones they are currently giving. It could also be that they have such intense exposure that it raises their risk. Those are speculations.
Okay. Well, then, to shift to a different direction, the oncology wings, St. Jude's Hospital, they have very clear signs telling people if they've been recently vaccinated with certain vaccinations, they are not to come onto the wing or come into the hospital. There's nothing about the unvaccinated. Can you explain that?
And again, as Dr. Blaisdell's mentioned, it's a theoretical risk that they're trying to belt, suspenders, and a piece of rope to hold things up and just make absolutely sure no one is bringing that on. I mean, they're already saying don't bring sick people in. But for live virus vaccines, and that's what we're talking about, and there are only a very few of them, measles, mumps, German measles, the rotavirus vaccine that we give to infants, one type, the nasal spray influenza vaccine, those are live virus vaccines. We haven't used the oral polio vaccine in the U.S. for many years. That would be the other one. There are a few other vaccines that we do not routinely use, such as yellow fever, that are live virus vaccines. But there is a theoretical risk, and because their patients, some of them are totally without any immune protection, they want to make extra special super sure that that's not going to be a risk.
Oh, sure.
If they're so concerned about the risks of their patients, why do they not include the unvaccinated?
I don't know. And it would have to be because they're also working very hard to keep anyone that is ill off premises, as in visitors.
Thank you.
Thank you.
Okay, so we're not in a public hearing, so unless there's any more questions, we're going to resume our discussion.
Okay, this was in reference to the senator's question.
Okay, we've already heard from two people. We're going to hear from one more, and then we're going to resume our committee discussion.
Great, thank you.
So the question originally was, Senator?
I believe that there was a couple of questions. One of them was if individuals who have received vaccination can contract the vaccine, and the other question was if individuals who have been recently vaccinated pose a health and safety risk to individuals who are immunocompromised.
So thank you, Senator. My name is Dr. Zach Mazzoni. I'm a family medicine physician, duly board certified in family medicine through the osteopathic and the allopathic boards. I practice in Bath. As to your question from contracting disease, I worked at the Bates Clinic in the 2016 outbreak for mumps. And there were 8 cases that we saw. Of all the 8 cases that were seen at that time, all of them were immunized. I checked the records personally. We did not have one case at that time for our unvaccinated students that contracted the disease. They were quarantined. I think Bates did an excellent job of trying to manage that. They worked extensively with the CDC and did a very good job of trying to provide education. But to your question, yes, it's absolutely possible, and it did happen, and I saw it personally at Bates. The second question, I think, was answered quite well by the other physicians that had come before me. As far as shedding, that is a theoretical risk, but I can tell you that practically and what I saw personally, that it absolutely did happen for people who were vaccinated to be able to receive the very disease that they were vaccinated to be prevented from getting.
Thank you, Doctor.